We're about to delve into the world of healthcare in the United States for a special two-part series as we explore our healthcare crisis. And we ask the question, is there a solution? We're going to discuss this vital issue which affects all of us from every angle possible. A comprehensive discussion with some leading healthcare experts. First, some context. There is no question the U.S. has, well, some of the finest and most brilliant doctors and hospitals in the world in every field of medicine, every discipline. Amazing cutting-edge technology, incredible life-saving surgeries, techniques, protocols, procedures. That is just a fact. With that said, the healthcare system, the system itself in the U.S. can be miserable for many. That is also just a fact. There are so many things wrong with our healthcare infrastructure today. Patients constantly complain about things like being lost in the shuffle, lost in a myriad of healthcare system complications, poor hospital care, poor doctor care, the skyrocketing costs, the insurance premiums, the lack of services, physicians not listening to you, not being there for you. Healthcare can be a never-ending struggle these days. Why is that? What's wrong with the system? Is there a solution? We're about to find out in a brutally honest, uncensored discussion as we bring you part one of our two-part series, Healthcare Crisis, Is There a Solution? And joining me now to discuss all of this is a great panel of experts. Dr. Cory Waldman is a board-certified cardiologist specializing in internal medicine. He's also the medical director of a Los Angeles hospice company. And as part of his private practice, Dr. Waldman also specializes in what's known as concierge patient care. We're going to talk about that. Also joining the panel is Dr. Ilan Shapiro. Dr. Shapiro was a representative for Mexico as part of the World Health Organization, the WHO. You've heard of that. Dr. Shapiro is a board-certified pediatrician. He's involved with community engagement and special programs that really help connect the community with healthcare. And Dr. Shapiro is currently a community physician working as Chief Health Correspondent and Medical Affairs Officer with Ultimed Health Services. That's a federally qualified healthcare outpatient center. And also joining the panel is my great and amazing friend and former news colleague, Elizabeth Espinosa. Elizabeth was a reporter in Los Angeles, here in Southern California, for years with KTLA, Fox, CNN, PBS, the list goes on. Believe me, everyone in SoCal knows Elizabeth from the news. Now, what many do not know is Elizabeth walked away from an amazing and accomplished career, really to devote her entire life to taking care of her special needs brother, her very ill mother, and her father, taking care of them almost single-handedly. Elizabeth, honestly, she is a warrior. She puts her family before anything. So thank you all so much for being here. I'm honored to have all of you.
Thank you.
Takes one to David. Your name, and one day we will do a show about your story because you've done so much.
Thank you for another day, Elizabeth. You're the best. Now, Elizabeth, I have to begin with you. You know I have so much respect for you. I know your story. The public does not. So take a few minutes, share as much as possible with our audience, which then helps begin the discussion about healthcare with our panel, with our great doctors. Go ahead, Elizabeth.
Thank you so much. And it's such an honor to be with this panel. So, Dr. Shapiro, Dr. Waldman, thank you, because, the truth is we need our healthcare professionals that walk along with us as patients and as caregivers side by side. And there's so much that we have to exchange information so that we can fix the system. Randomly enough, take a look. I feel like I'm still reporting. I'm in the hallway on the 7th floor, the cardiovascular floor here at UCLA in Westwood, Ronald Reagan. And I'm sorry if the camera shakes a little bit and if it's a little loud, but it's just, here we are. My mom, unfortunately, we tried so hard to keep her away from kidney failure, and it just happened. We don't know where it came from, but my mom, unfortunately, her kidney function just went kaput, fancy terms, right? And yesterday, it was very scary. My mom had to have surgery to get a catheter in, hoping that she was going to qualify for that because my mom also has Dr. Waldman, CHF, congestive heart failure. So there's a lot of challenges. Is very resistant, and her blood pressure is awful. It's always like stroke levels. It's frightening. So the kidney function and the failure has not helped. And so now my mom needs a kidney transplant. So I'm putting that out there as well. But, that started a long time ago, as David shared. I'm a special needs sibling. Unfortunately, my brother suffered hypoxia, so it's lack of oxygen at birth. And, I don't like loud. I'm at a hospital right now, but the truth is it was medical malpractice. And so my brother, we found out, we discovered at 2 years that, he was not going to be able to meet a lot of milestones. And so Christian just turned 40 years old this week, which is amazing, but he is nonverbal. He's diabetic, he has hypertension. So imagine having to care for somebody that can't tell you they have a migraine or they have left arm pain, or that their eye, they're starting to see an eclipse. And that means that he was going blind. So his retina detached. And so he did go blind in his left eye. And now my father, unfortunately, he's had diabetes for many years, but now it's only gotten worse, because what that can lead to, as the doctors will tell you, is vascular dementia. So my father's now challenged with that. And that requires 24-hour care, supervision, that requires make sure they eat well, make sure they're taking their medications. My phone is blowing up as we speak right now. Doctors call me. I'm trying to learn now peritoneal dialysis. We're going to try to do this dialysis that people do at home now, as opposed to the in-center, because it's easier on my mom's heart. Thankfully, she was able to do this. I mean, I'm on 2 hours of sleep, so no makeup, yesterday, and God knows when's eyeliner. But, we do this because we love our families, right? And I think that I want to thank the powers that be, regardless of your religion, who you pray to. But for me, God has been so amazing to hold us up and have people like David and yourselves, Doctor, here to, understand that community. We need this. I'm a journalist, and I ask hard questions, I like to think anyway, and sometimes smart ones, not always. And it's still a challenge, and there's still barriers, and it's still hard, and it's scary. So I can't imagine for families that don't have some of those tools in their tool bag, right, to get through the system, to navigate these waters. I mean, it is incredibly challenging. So I'm excited about this conversation, because I think that together is how we find those answers. And I will tell you, I only have a more educated, if you will, opinion about the way the system should function, especially for folks with disabilities, folks with dementia, the elderly, the digital gap that exists, the cultural gap that exists, and really empowering our young doctors to not just look at the monitors, the clinical presentation. You got to look at the whole picture. So I'm very excited about that, and thank you for this opportunity to speak with you all.
Elizabeth, so well said. Your story is amazing. You're amazing. So let's go to Dr. Waldman. Dr. Waldman, you heard the story of Elizabeth Espinosa, her family. The reality is, no matter how great you doctors are, no matter how great hospitals are, we've got a problem. Let's take patients to begin with, Dr. Waldman. They've gotten so lost sort of in the shuffle today. Medicine seems to be a business. I'm going to be honest, uncensored here, sort of profits over patients to a degree, and the doctor-patient care sometimes seems like a thing of the past. There's not that personalization anymore. Dr. Waldman, can you talk about this sort of dynamic? And then obviously you as doctors are dealing with things as well. Dr. Waldman, the floor is yours.
Yeah, no, I completely agree. Part of the reason that I do what I do, which is more of a hybrid practice, which is kind of a blend between the traditional model of medicine and more boutique care or concierge care, or a direct primary care, it goes by a bunch of different names these days, is to basically eliminate those burdens, mostly administrative burdens and hassles, that are impeding good healthcare. A great example is, I was recently looking at some statistics, and in major metropolitan areas, if you were to go call a doctor's office and say, hey, I need an appointment, new patient could take easily a month. That's assuming you get a phone call back. And in the case of, specialists, like, for example, Elizabeth, your, father needs very advanced care. Getting an appointment with a nephrologist or a cardiologist, yeah. I hear examples of people saying, oh, yeah, I called the office, and again, a week, 2 weeks go by, they get a phone call back. Oh, next available appointment, 4 months.
Yeah,
which is absolutely, which is insane. This is not a model of healthcare that's sustainable. It's not sustainable for patients. And, frankly, a lot of us who are actively engaged in healthcare, we're doing this, for the patients. And we are getting handcuffed by the current system.
I have the feeling with Dr. Waldman, and the reality, and especially the communities that I serve, sometimes, getting access is just a dream. I work with underrepresented communities where finding a doctor that has linguistically and culturally concordant opportunities to communicate with a patient are almost non-existent. Then we know right now, especially after COVID-19, that we are losing a lot of doctors. And sadly, we are not creating enough. And some doctors that are international medical graduates are not being able to actually help the system. Then we have a lot of barriers out there. Then it compounds that problem of seeing the patient as a number. And also, we are not creating enough opportunities to sustain our current system. Then as a patient, you want access, you want healthcare, and sadly, a lot of the times you end up just using the ER. And sometimes, especially right now, that a lot of patients are being dropped by Medicaid, it's a problem.
Yeah, Dr. Shapiro, piggybacking on what you were just saying, I recently saw some numbers that, at least on the physician side, 50 to 70%, give or take a little bit, of doctors are completely dissatisfied and, in quotes, burned out, which is astronomical. So we are, losing healthcare providers and those who are capable of such services a lot greater than we are generating them. And a lot of this is documentation burdens, insurance companies. There's other numbers out there that for every minute a physician spends with a patient, 2 minutes are devoted towards the electronic medical records, the administrative tasks, just significant burdens that have absolutely nothing to do with providing good quality care, which we know at the end of the day, it's just a function of spending time with a patient and family.
That's true. And I want to just say, David, one of the things too that you and I have talked about with our family members is on this side, right? Is that, like, for example, you go to any emergency department right now, it's full. Good luck getting a bed. It used to be where you could wait, 5 hours. It was like a big deal, right? But you'd get a bed that night. I've spent 3 days in the emergency department here at UCLA because they don't have enough beds. They got the traumas coming in. So everything backs up. Well, guess what happens? Somebody that aspirates, my father sadly aspirates a lot, which means that, doctors, you have a better explanation of that, but basically you catch pneumonia and you can die from that. So I bring him in because his oxygen is tanking, and sure, they'll help him right away, but then he sits in an emergency department without a support person. And even if they give you a support person, like a sitter or something, call it, for those of you that don't know what I'm talking about. And I will tell you, I said, you don't know him. You don't know him. That's like if you have a toddler, putting some stranger that says, yeah, I got a certificate, I worked with little kids. I don't care. You don't know the way this person acts, what this means, and so what sets him off and what triggers him. So I have to sit in that ED with him, the emergency department, ER, and I am floored. And I understand there are liability concerns. I get it. But what's happening is that they're coming in sick and they get sicker. You know why? Because they're sitting there. They can't make them sit. They won't let them sit up, or not sit up, but walk around the ER because it's unsafe. You've got a lot of germs. I understand that. But there's got to be a way around it, because there are studies, and speaking to even some of his doctors have said, yeah, a lot of elderly folks coming into the ER, as an example, it's like a crash. You come here and you get sicker, like a car crash, and you don't survive, and they don't come out of this. You're not supposed to go to the hospital, get sicker. And you should be able to call your doctor and get an appointment and see somebody within, I'd say, a 3-week period. Not 6 months. I am the pushiest person when it comes to that, because I will not take, talk to me, call me in 6 months. I'm like, no, I say it to the clerks, because it feels like everybody's checked out, even from secretaries, administrative staff. I say, I'm sorry. If I see them in 6 months, I go, they'll be dead. They'll be dead by then. We got to do something about it. We got to think outside the box. We got to create new spaces, figure out alternatives. We're going to the International Space Station in 2023. How is it we can't figure this out?
Dr. Shapiro, I hear Elizabeth. I hear her so loudly and clearly. So with everything Elizabeth has said, Dr. Shapiro, what Dr. Waldman has said, why is, in your opinion, the healthcare system failing? Listen, something is wrong here. And the healthcare system, as Elizabeth said, it can be frightening. It can be disastrous for too many people. That is just a fact. I'm not walking it back. Some of you doctors are to blame. Some of we patients are to blame. But the system is miserable. Is there a fix, Dr. Shapiro?
David, I believe so. I do not know if it's going to take us 400 years or a couple of years to actually make the change, but at the moment that we start redesigning the way and the priorities that we all have, understanding that all of us as humans, we actually want to be healthy and we want to be part of a system that takes care of us. And right now, a lot of the efforts, especially after COVID-19, we saw the importance of preventive services. Why? Because we saw that we were overweight, we had high blood pressure, we had diabetes and other chronic problems. We had more problems when we had COVID-19, and it took us to the ICU and other complications like that. And not only that, that the preventive part of the healthcare system is not well funded. Then, we're trying to fix with Band-Aids a lot of the diabetes cases that we have, a lot of the struggles that we have with mental health. Then it goes on and on. The question is here, how are we training each other as physicians? Are we creating enough doctors that understand the importance of talking with our patients, being there with the community, not just being subspecialists, but actually primary care, internal medicine, family docs, pediatricians, OBGYNs that actually are the bulk and most important part of, preventive services, and also triaging what's happening with our community. Also, we are seeing the problems that are happening around the country. A lot of the hospitals are closing, and especially in rural and underserved areas. Yeah. That actually is closing a lot of the systems that we have for deliveries, the systems that we have for emergencies, trauma, emergency, anything, or just regular procedures like a colonoscopy. And patients are needed to actually run or actually travel hours to get them to a safe space to do the procedure. Then making sure that our community clinics, that our public health system is working, and also encouraging all of us to have better communication, because technology is amazing, but it depends how we're using it. If we're using it in a positive way, it can make a huge difference.
Though you said something priceless, communication. There is not very good communication, whether a doctor talking to a doctor talking to a nurse, a doctor talking to a caregiver, a doctor talking to the patient. What are we losing? Why are we so disconnected? Has it always been this way and it's just getting worse now, Dr. Waldman?
No, yeah, I'm going to definitely jump in on this. I think that the issue is that our current model is suggesting that the doctor should be communicating with a computer, and the computer should be communicating with the nurse or the other physicians. We have lost the ability to pick up a phone and make a phone call and have a direct conversation. And I do believe that's a huge impediment to healthcare. In my practice, I have the luxury of, if somebody comes in with a problem, I don't know whether it's a foot problem, an ankle problem, I can sit there and send a very quick text message to one of my colleagues or friends, even people I don't know, and say, can you do me a favor? Can you take a look at this person as soon as possible? And the answer I tend to get based on my model is, sure, have them come now. And if they can't come now, have them come tomorrow. That is a huge advantage for that patient.
Is that part of the concierge medicine, Dr. Waldman, or should it be implemented in all practices? Because I was reading a little bit online about you, and you're not only a concierge doctor, you have practice, you have the hospice, but I read something, you're a hospitalist. What the heck is a hospitalist? I've never heard of that. I want to know if Elizabeth heard of that, but Dr. Waldman, what is that?
20, 30 years ago, and don't quote me on these numbers, but your primary physician would manage your care while in a hospital. The person that knew you medically would manage your hospital situation, whatever that may be. Somewhere along the lines between the bureaucracy of a hospitalization, the paperwork, it became extremely complicated, where a private practice physician could no longer, in a reasonable way, navigate both their practice as well as the management of a patient in a hospital. Therefore, the concept of a hospitalist was born, which is essentially the quarterback of a patient while they are in the hospital. They manage all of the acute care, they're coordinating all the specialists, thus alleviating the burden of that for the private practice doctor, which frankly just doesn't have time anymore to manage the care of a patient in a hospital. That is what a hospitalist is. So think of it as your hospital doctor.
Elizabeth, I just want to get back to you because Dr. Waldman is talking about managing the care. How do you manage the care? You've got Christian, your brother, you've got your mom, you've got your dad. You've got to be exhausted, you've got to be physically spent, you've got to be war weary, so to speak. How do you do it?
You're sweet. You know what? I think that love moves mountains, right? That's just the reality. I think when you love your family, they did it for us, right? I always think about all the challenges my parents have gone through to, raise us, and not to mention like the countless families that I've interviewed over the years that left me in awe, right, in different communities. So I don't look. I don't ask for pity party. I just say this is what it is, and I think it's so important that we empower ourselves with as much information as possible. And this is the one thing I will say, David, you asked me how, one of the keys is I ask all kinds of questions. I'm like, I don't care if I look stupid. I don't care. I mean, how am I supposed to know everything? I've not had kidney failure before. I don't know anything about peritoneal dialysis. Like I have to go talk to a nurse this week. My mom has a foreign object in her stomach right now. And she was like, this feels weird. She's like touching her belly right now. I said, I know, Mom. I said, but we're going to find out. We're going to learn, I think it's just by trying to really, it's one step at a time. It's one baby step at a time. It's asking as many questions as possible. It's having friends and community. And I would say, like, if you know somebody who's a nurse, ask the nurse, like ask the neighbor. If somebody, peer mentorship is everything. I want to thank the Negrete family from Silmar, that the core kidney program here at UCLA, like they got a transplant here. This whole family is impacted by kidney failure. The mom was like in her 60s and had a transplant. So I said, Mom, she was on dialysis. We're going to drive to Silmar and you're going to meet with her. And it's like Latina to Latina, hablando en español. Dr. Shapiro knows it makes a difference. It makes a difference, the age group and the Latina group, right? And the ethnic group. And if it's an Armenian, it should be an Armenian person talking to that person. And really, getting that information so that you empower yourself and you don't feel alone. I mean, that's the one thing I know, and of course with Christian, my brother, we've been in that fight for a very long time. Christian just turned 40, which is unheard of. And my challenges with him, I will tell you right now, my goal, my dream, oh my gosh, is to have a hospital, like a children's hospital one day for special needs individuals. Listen carefully, with behavioral challenges and sensory challenges, because it's not about calling security when he doesn't want to sit in a room and he's yanking out his IV and he's not going to put the face mask. He's desatting me. His oxygen's going down, but he doesn't want anything on his face. So you blow by, right? You put it on the side. Then you figure out ways like, okay, maybe it's like Jurassic Park hospital, right? Like this is my vision. We got to think outside the box. Like, this is what we did for COVID. Nobody thought you were going to do, vaccines in a car, blood draws in a car. Well, I said to people, we've been doing that, because I have had to be really creative with my brother, because Christian is, those of you who know him, because he's very popular on social media, I talk about him with Mr. Great Pants, right? My Instagram at Elizabeth Espinosa. Christian is 6'2", like almost 300 pounds. He's like a linebacker. And many times, at UCLA, we've been here, and he won't get in a gurney. We have to put a big white sheet on a wheelchair to pre-sedate him, because we have amazing relationship now for years with an anesthesiologist that will go outside of the ER to give him a cocktail to pre-sedate him. And then in the wheelchair, he gets sleepy, and then we kind of roll him in, because he won't go to the back where everybody triages. He won't get in a gurney. Like literally, I have to get into like a bunny suit. So like scrubs type of thing. And I have to go all the way into the OR until they put him to sleepy sleep, because he's scared, he's afraid, and he has this resistance. So it's like, it's thinking outside the box, Dave, is what I say all the time. Like, don't feel weird about saying, well, doctor, what if, and I have so many examples, but another one is Christian had a really big cyst, like a sebaceous cyst on his neck, and it was getting worse, and I didn't know what to do. And dermatology is like, well, if he doesn't come in the office, we can't treat it. And I was like, okay, great. But he doesn't, even open his mouth to cooperate to check his teeth, right? Like a dental exam. Thankfully, I have a friend, God bless him, thank you, Rich, who is a ER medicine person. And he's like, let's go to the driveway. Christian likes to sit in the car. That's his safe space. And we gave him a little bit of medicine to make him sleepy. He brought some lidocaine. We put it on his neck. We let that work. It's magic. We pulled out a wheelchair. I think it was my dad's because we don't have one for Christian. So we pulled that into the driveway. We sat him finally out the car. We put the iodine on his back and we cut it and we took it out in the driveway of our house. You might think that's crazy, but guess what? We got it done. Otherwise, what am I going to sedate this guy just for that? Put him on a ventilator? You know what I mean? So
Yeah.
how do we do that? How do we replicate that? Because Christian, my brother, is only one person, but there's so many people like him, right? And I think COVID really underscored how folks with disabilities and behavioral challenges didn't get access to healthcare and weren't even allowed their support staff to be in some hospital settings, which caused them their life, you know?
Dr. Shapiro, you represent communities that are underserved. Now, truth be told, whether you're underserved, you're middle class, you have a lot of money, healthcare costs a fortune and it's tough for everyone. But let's talk about poor people because that's what they are, poor. Forget the politically correct low income term. Poor people need help. They need your health care. Dr. Shapiro, when you deal with an underserved, impoverished community, what are the challenges that you are met with these days? Because obviously the system is failing. And then talk about low income folks, but then obviously everyone else on the financial spectrum because getting adequate health care, it's not there anymore.
David, day by day, when I see my patient and they come to my clinic, I see them as an honor for me. And let me tell you why. We need to see where they're coming from on the community. They probably have 2 to 3 jobs. You know, they are probably actually at that moment because they are hourly. They're not getting paid and they're coming to our clinics to be served. And that means that they needed to allot money or time for a daycare, making sure that there was gas on the car if they have a car, or at least make sure that they are on time for the appointment because of public transportation. Then there's a lot of barriers around them in order for them to get to the clinic, let alone be healthy. For the other side, you know, I tell them the truth, and they know the truth, that we need to be healthy and eat certain things, vegetables, certain lean things, go out there and do exercise. And at the end of the day, when they go out on the community, there's a couple of things. When they go to the supermarket, they have the choice to actually get the green stuff or fight against hunger. They have the option to do exercise. And they go, well, maybe there's not a green space. Or the green space that is there, it's not safe for them or their families to actually do some exercise or actually be out there. Then there's a lot of barriers and social determinants of health opportunities there that we can start managing. Then at the moment, and that's just the structure that we have around this. You need to add culture, you need to add language barriers, you need to add also the other part as physicians in our healthcare system, that when we're not used to actually taking care of diverse populations, well, that culture, that touch, it's way different. Why? Because one thing is, you know, you can tell the same thing about diabetes. It's the same thing for diabetes for everybody else. But taking away, for example, a tortilla from an Hispano-Mexican family, well, that's probably not the best way to talk about it. Maybe we need to twinkle around other dietary things that we can actually improve. Then putting everything together to cater our underrepresented communities is extremely important, especially right now that we have all the things that are happening with redetermination with Medicaid and here in California, Medi-Cal. What's happening also with kids. Then if we're not taking care of all these populations, well, it will become a public health problem.
Elizabeth.
Yeah, I was just going to say, let me say this, and you're right, Dr. Shapiro, because, you know, one of the observations I've made being in the emergency department very often with my family in clinics and hospital settings is that our underrepresented communities, they show up and they show up very sick. They show up when they already need a heart transplant. They show up when they need a kidney transplant. If they don't get it, they're done. And I think it's also one of the other challenges, like we have this, I would argue that law enforcement also has to do a better job at, is it goes back to communication. You have to be a good storyteller. I know that you signed up to be a journalist, but you have to tell people. Let me tell you why kidney function is important. Do you know why your blood pressure goes up? Because if not, you have to see them through the line, because people don't understand. They say, well, I got diabetes, but it'll be fine because I don't feel anything right now. Well, you don't feel it today, but every day that you don't control your blood sugar, you're killing little veins. That then means when you see that guy without a leg that got amputated, that's because he didn't control his sugars. It's the baby, it's everything. But really explain to people the full rainbow. It's incredible. That's why I'm really proud of this. Dr. Rastogi here is a nephrologist at UCLA, and he has this core kidney program where they have folks from all ages who've suffered, kidney disease, have gotten transplants, or living donors, which we really want to make a push for as well, right? Organ donation. But it is an incredible group because they're out there trying to explain to people why it's so important. That peer mentorship really explains it. So it's interesting. My mom, with her kidney failure now, we happened to we were in the city of Lenox just a couple days ago before this surgery. And we went to a Salvadoran restaurant. My mom's from El Salvador. And we walked in there, and my mom starts talking to the owner. And while I'm paying, I look over, and my mom, who's petrified of going on dialysis, right? And about to have the surgery, she goes, Elizabeth, this woman, she's like 57. She's so young. She looked so much older because she's in kidney failure. Her GFR. So you learn these things. GFR, right, doctors? That means your kidney function is at 6%. And I said, when is your follow-up appointment with your nephrologist? She said, January. This is in November we're talking about. I said, you're going to be dead in a month at that rate. Your heart's going to stop because your kidney is going to affect, and you guys speak to that. I'm not trying to be the doctor here, but right, it's going to affect your heart. It's going to do all these things. You got to understand why it's important to take action now, right? So I think we have to explain it too, because I will sit there, because I am a reporter, right, David, like you, and I can hear when doctors are explaining sometimes to my parents, things, and I'm like, okay, take it another step. You got to take another step. Explain to them why that's important. What does that mean if you don't do that? Like, we're all, it's like back to first grade when you get diagnosed with something that you've never been diagnosed with. That's the reality.
Yeah.
Elizabeth, I'm smiling in my heart because the things that you're saying is so true. And I have a phrase that actually I understood during COVID-19 is that we need to translate medicalish to an actionable language for our community.
Exactly.
That's extremely important, especially for anybody. It doesn't matter your language, your color, your status, your religion. Having that conversation is so important, and also connecting the dots. And you're mentioning something that actually triggered me, and that's the word that I'm using, because at the moment that we do not have information, one thing is having information and not acting upon it. But if you do not have the choice even to understand what's happening, there's no way that you can do anything. Then at the end of the day, if you vaccinate or not, that's on you, but at least you have that balancing act based on evidence-based information to act upon it. Then at least giving that chance is so important.
Dr. Waldman.
I think that there's three pivotal, crucial elements here. One is patient education, two is distrust of information, and three is time. To me, the primary issue is a lack of time that a physician has to build a rapport with a patient and a patient's family to gain the trust needed to make appropriate medical decisions.
And I felt that even with my mom, David, because I felt like nobody wanted to say, I think you need to go on dialysis. That's a hard thing to hear. I mean, I was crying for weeks, and my mom too. But I said, Mom, let's not die before we die. We don't be paralyzed by fear. We got to do this. And to your point, Dr. Waldman, drive-through medicine is a problem. And I've been through that. And I've had to cut doctors. I mean, I have no problem being, a little bit more assertive, like David, when we've had to be advocates for our family members to say, hey, don't rush. They're asking you a question. They don't understand. You got to break it down like you're talking to a 2-year-old, because even I don't understand some things, right? This isn't what I spent 20 years studying, that you did.
Yeah, I have to battle medical information that patients and patients' families obtain off of TikTok.
That's right.
The 16-year-old who's promoting, a certain gummy, a vitamin, a this, or that, it seems to have much more medical weight than I do, which is baffling. And this is the situation we're in.
There's another thing I noticed, Doctors Waldman and Shapiro. Correct me if I'm wrong. Maybe perception is reality. It seems there is so much burnout in your field. You guys as doctors are burned out, and I say that because it's complicated. How do you as doctors navigate a system, and I'm not going to walk back what I'm about to say, that's infested with bad doctors, insurance companies that are disgustingly greedy, and lawyers who are even more disgustingly greedy, ambulance chasers? You've got to deal with all of this, and you're dealing with it, then affects every patient. Can both of you talk about that? Because healthcare system is failing. The system is broken.
Yeah. Elizabeth, you mentioned the story of your brother, with regard to the cyst, on his, that had to be extracted. And I don't think that story would happen regularly for the simple reason of the doctor's fear of legal action against them.
Right.
So it brings up in a whole discussion of tort reform and what can we do to take some of the threat of lawsuits against and away from doctors and healthcare providers.
No, and I think that's fair. And I think that there has to be, as families, like I always say, so many times, like we will be in a hallway or something and they'll say, well, we can't, do the IV, start the IV in the hallway because of HIPAA violations. I'm like, I'm releasing our HIPAA on his behalf, or my parents. Like we need to get the health care. We need to get that's the outcome is what matters, not some law that somebody passed, right? But to your point, I agree. As a family, I think let's come up with a legal document that says, look, you're taking a risk by doing this in your driveway. But if you're willing to take that, you've got to give the doctor a chance. You can't just sue them and say, well, this just turned out wrong. Well, it was in good faith. Everybody was working in good faith. And I think that's what matters. So we need to get some lawyers on this show and say, let's create that. Let's get some legislators and say, how are we creating loopholes for people that like I say, disability access within healthcare isn't just a wheelchair ramp. It's not just a wheelchair ramp, right? It's giving you guys access too, so that you can see a patient not in the normal setting, because accommodations for people with sensory issues, with autism, doesn't mean a wheelchair ramp. It means in the parking lot. It means in their car. It means in their house, in that one space in the hallway where they will let you touch them. Like, that's how unique it is. And that's how patient-centered we should all be when it comes to healthcare.
There's an even simpler problem, and Elizabeth, I know in all of your years of reporting, I'm sure all the health stories you did, patients say the same thing to you. And what I'm hearing when I do my health stories is, we have to wait forever just to get an appointment, sometimes months. We have to wait forever to get an MRI. We have to wait forever to even find a specialist. This is a joke, Dr. Waldman and Dr. Shapiro. Whoever wants to talk about that, go ahead.
The reality is that we love to have a decent way to answer what's happening right now on our healthcare system. I can tell you for sure that it breaks my heart when I hear that. It breaks my heart when grandmother comes with their kiddos with me, and I need to give the vaccines, and I'm asking regarding everything, and I see that she's limping, and she tells me that story that she doesn't have access, and she goes to the ER, and she doesn't know how to she can get access to a healthcare insurance, but it's too much for her, and she doesn't know how to get the Affordable Health Care Act plans for her, or she doesn't know where to go to community clinics. And there's a lot of things around what we have in our community that it's already there, but somehow we're missing the point of communicating that we have certain tools out there. On the other side, we need to see all the barriers that we have created. Of course, every doctor statistically will have some type of lawsuit at least drafted against them at some point in their lives. That's something that, if we did something wrong, we need to be punished, and we need to take care of that, and we be honest on that one. But also we do a lot of overshooting with a lot of these things. The third one is that the system, we have a lot of intermediaries. The idea of actually having a primary care doctor in the old days, and I love what Elizabeth was saying about, my patients that have the neurological conditions, I love doing telehealth with them. I love actually approaching in a different way because they don't see the white coat. They actually enjoy the interaction. I get to see a little bit more about their house. And that's stuff that I used to do in Mexico. And right now, for the first time, at least I get like a little window of what's happening with them. The kid is actually maybe smiling, but not like terrified of running around in a different setting. Not necessarily because he's medical, but it's not his house or home. Then there's a lot of opportunities there that the system can actually improve and go out from that box of the clinics, of the healthcare system. We need to move to social determinants of health. We need to bring community healthcare workers to the conversation. We need to make sure that we have a nutritionist, medicine as food as medicine. That's a new thing that we need to be talking about.
And Dr. Waldman, as we segue, these stories all of you have told are somewhat unbelievable, somewhat amazing. With that said, let's take our remaining minutes. We're now into our second part of this healthcare special. In our remaining minutes for the remainder of this program, what are the solutions? How do we fix a broken healthcare system? Let me give each of you about 2 minutes. We'll go to Dr. Waldman, Dr. Shapiro, and then Elizabeth, who's been dealing with it firsthand.
Yeah, I think to me, one of the biggest issues that the system is having is that we don't have enough time. Physicians, healthcare providers just don't have enough time to provide patient education, which builds trust and rapport, which ultimately leads to better decision-making for patients and families. So if we can go after that time component, we say to ourselves as physicians, well, where is all of our time going? And right now, the vast majority of it is going towards documentation, which is frankly for medical billers and for lawyers. It is really not for the patient, unfortunately. If we can buy back some of that time, all of that time can be devoted back to patient care. We could probably legitimately double our effective healthcare workforce overnight by addressing the documentation burden and the bureaucracy burden.
Dr. Shapiro. Thank you, Dr. Waldman. It sounds good. If we can implement it, maybe that's another story for a future broadcast. Dr. Shapiro, your ideas about solutions.
David, we need to start creating more doctors. We need to make sure that we are going and outreaching the underrepresented communities and bringing doctors for many communities. And by underrepresented, it's every color and flavor that we have that will stay on that community and serve, because that creates an amazing pathway. That means that from high school, college, med school, and actually even residencies, to make sure that that pipeline exists and we bring up the amount of doctors that we have out there. If not, we will just be chasing something that we'll never achieve. The other thing is something called value-based care. Right now, Dr. Waldman and also Elizabeth had mentioned the importance of quality interactions with our healthcare system. And maybe it's not specifically a physician, maybe it's a nutritionist, maybe it's a community healthcare worker, but making sure that we're creating a healthcare system that is humane, that it's actually for our patients, and it's the quality and actually the resolution of the problem, and most importantly, the prevention of them. They are key and crucial for the future of our community. And finalizing with this, making sure that we continue translating medical-ish to actionable opportunities for our communities. If not, all the information, all the distrust will continue to boil up.
Elizabeth, as great as the doctors are, no one better to ask than you. You are in the trenches. You are a caregiver and a reporter, I guess you could say, a journalist. Give us your perspective on solutions for a broken healthcare system.
Well, you know what? I want to thank, Dr. Waldman and Dr. Shapiro and all the doctors that are out there, and nurses and LVNs and CNAs and caregivers who care. First, we got to care, because I believe it is about caring. It is about having a will. You have to want, you've got to have this desire to say, you know what? We can change this. Why do people act like just because this is the way it's been, it's got to be this way forever and it's going to stay broken? No, let's have that will. I think Dr. Waldman, you talked about, you do home visits, right? Like concierge, right? So I think it's about accessibility. So it has to be, how do we fix this? There is a solution. There are solutions, maybe not overnight, but they're baby steps. And there's little solutions every day. So for example, UCLA has a program now that I think is great. It's called the Extensivist program. So people that are chronically ill, so the way you try to keep them out of the hospital setting is you give them longer appointments with a doctor, a primary doctor, that instead of spending 15, right? I think, isn't it, doctors, 15 minutes usually is what you get with a patient. You get 40 minutes, woohoo, right? Still not a ton, but 40 minutes with a patient that's got a lot of complex medical needs. So that's helped a lot, let me tell you. But then it's also about fixing, to your point about home health, making it accessible. Why do we send everybody to the emergency department because they hurt themselves? It's like they need IV fluids. Let's get it easy and set up through home health. It should be an app. Like, why aren't we thinking about that? We got to think outside the box. Patient-centered care means let's make it accessible, because I think part of the problem is people go to try to get medical attention, and everything is an act of Congress. Even when I leave the hospital and I get a home health, order, the doctors, God bless them, they like, Elizabeth, I wrote all the orders. I put a PT, physical therapy, and OT. And by the time the home health agency calls me, and I see you're nodding your heads because you know what I'm talking about, right? And so let's make it simple. Let's make that faster, quicker. Even at the county level, there's a program called In-Home Supportive Services, right? That program is supposed to help get caregivers. We need to also fund for caregivers, because that's going to help people not get sick and end up in the hospital, right? And need all these specialists. And more doctors is a solution, but it's got to be also quality over quantity, right? To like that you care. And I think going back to the IHSS comment, I was in that office the other day and I met a woman who has stage 4 pancreatic cancer. She had to go in there with her aide because they can't even make a phone call to get through to the social worker so that the woman gets paid. Because if the woman doesn't get paid, she's like, I gotta leave. I gotta go find another job. And she'll find another job. But guess who won't find another staff that quickly? The woman with stage 4 pancreatic cancer. And those are underrepresented communities that are impacted the most. So I think private practice needs to make things more accessible, and generally are better at it anyway. But also programs that are funded by government and Medicaid, they've got to make it more accessible and easier. And yes, I think that making doctors do all this paperwork is taking away from spending time with patients and really saying, this is what you need and this is how we make it, work faster. So I think if we just all sit down and say, let's take top five, let's fix this, and this, and start with that, we can do this.